My name is Jamie Reed, and I hold a Master's of Science in Clinical Research Management from Washington University in St. Louis. I am also a lifelong Democrat, a mom of 5 boys, 3 of whom were adopted out of the foster care system, and I'm a lesbian. I am also the public whistleblower from inside a pediatric gender center. I participated in transitioning nearly 1,500 unique patients who ranged in age from 3 to 26. Now I understand I participated in an industry that was based on fraud, deception, and in layman's terms, we were running a racket. Patients were treated using unethical and deceptive informed consent practices. They were minor patients. They had significantly presenting comorbidities, some even meeting the criteria for a legal medical disability. The entire diagnosis is based on regressive stereotypes and self-described feelings. For an assessment to be diagnostic, there must be a statistically significant number of patients who will not meet the diagnostic criteria. Parents and the public have been deceived into believing that these assessments are diagnostic, that they're consistent, that they're comprehensive, and that no child is ever receiving treatment without one. But even if this field was completing a true biopsychosocial assessment and saying no to a significant percentage of the patient population, those who would be told yes would be homosexuals, and especially the gender nonconforming homosexuals. We would still be okay to be rendered sterile, without sexual function, with destroyed endocrine systems, and be allowed to die early simply because we are gender nonconforming homosexuals. One of my patients, after her radical bilateral mastectomy at 19, called begging for her breast to be put back on. Another patient's intellectual function was so impaired that they could not identify to me where they lived or explain what type of identification they possessed. This patient even stated that they desired to have biological children, yet they were prescribed a treatment that would ultimately render them sterile for life. We as clinicians in the gender industry openly stated it does not matter if patients even had gender dysphoria. If a patient said they were trans, then they were trans. Parents were unaware that patients were self-diagnosing, that clinicians had completely abandoned the diagnostic process entirely. Parents who didn't agree with our lies were isolated, abandoned by our centers, and we tore children apart from caring parents who told us no. Imagine if children went in self-declaring that they had a malignant cancer. If that child demanded to go through chemotherapy and surgery, that the clinicians would comply. This is precisely what we were doing in the gender center. What finally led me to speak up is that we significantly harmed our patients. We didn't just deceive them or their parents. I hurt the very children I was employed to protect.